Hello, this is Dr. Stanley Lang, and welcome to this video presentation. The focus today is on stress and blood pressure. So I have a question for you. Do you think that stress can cause hypertension, which is the disease of sustained high blood pressure or the condition of sustained high blood pressure? And if so, how much do you think it is of the cause of blood pressure? So of high blood pressure. So the context for this is going to be in a whole person health um, context where I address health of body, mind, and spirit all at the same time. And as you can see, my focus is on spiritual health as the foundation, but today we're addressing physical health and its connection with an emotional condition of stress. So again, stress and blood pressure is kind of an interesting phenomenon, because when hypertension was first named, it was named because the name got its origins because the belief that stress and tension was the cause of the blood pressure being high. That's where the word comes from. And it was only later that it was determined that most real high blood pressure is not related to at least acute stress. Now, as time goes by, we're discovering the role of chronic stress in the development of high blood pressure. So that's the that's for a different story and a much longer video than we're going to have today. But I wanted to just tell a story of a patient that I saw recently that had an event happened that caused fairly severe anxiety. So she went to the emergency room to see about this event, and at the emergency room she was found to have blood pressures that were in the severe and urgent elevation range. Basically, if she'd have been having more neurological symptoms, they would have called it an emergency, or something that required immediate attention in lowering the blood pressure as quickly as possible. But the blood pressure is just sort of discovered to be that high by virtue of the thoroughness that the emergency room takes when they're evaluating a person. She wasn't there because of blood pressure related stuff, but she just happened to have really high blood pressure. Well, I've known this person a long time, and she's representative of many people who very quickly can have their blood pressure rise into the severe elevation range in just minutes. And if you don't see their blood pressure at other times, you would think that they have severe hypertension, when in fact they don't have hypertension at all. And such is the case of this particular patient. But she was started on some blood pressure medicine before she left the emergency room, instructed to come for follow-up here. Still was quite worried about the issues that she'd been recently facing. And when the nurses first checked her, she'd actually come in 2 hours early. She was so worried, and her blood pressure was again in the severe elevation range. And so she had previously been on medicine for treating anxiety, and she requested if maybe she could try that. And so what we did was sent her out and gave her one single dose of the medicine for anxiety, which she took, came back 2 hours later, and her blood pressure was, lo and behold, only slightly above normal. Now, it went from severe elevation all the way to only slightly above normal in just 2 hours with an anxiety-reducing drug. And the point that I'm making is not that it's a great thing to be on anxiety-reducing drugs, but that stress, acute stress, had rapidly raised her blood pressure. And that happens to a lot of people, and a lot of people get misdiagnosed with hypertension because of that phenomenon. They walk into the doctor's office, they're nervous, they get the blood pressure checked, sometimes without waiting long enough, because you should wait 5 minutes before blood pressure is checked. You should be in a particular posture when your blood pressure is checked. And often people are not in those circumstances, and they're nervous and their blood pressure is checked and they're high. And the next time they're more nervous, they come back and the blood pressure's as high or higher. And so they get stuck on a blood pressure medicine, when in fact, if we took the average of their pressures outside of the office, they would be within normal limits. And I've seen this time and time and time again. But the fact that the blood pressure did shoot up that high is a sign of disease. It's just not a sign of the diagnosis of hypertension. What we're seeing there is an exaggerated response to stress. So that kind of a shooting through the roof blood pressure response isn't normal, and it's a sign that the body has learned to not handle stress very well. So there are a lot of different things that we can do that blunt the effect of acute stress on our bodies. It blunts the effect on our heart system, our cardiovascular system, our immune system, all the other various parts of the body that stress can affect. That negative effect can be blunted by learning how to do things that are essentially stress reduction activities. And again, that's a subject of a different video for a different day. But the point being that acute stress in your life very likely is having other effects that may not be as measurable with blood pressure, but having ways that blunt that effect is always a good way of living if you want to live in a healthy way. And that's why spiritual health is so important, because the spiritual disciplines are one of the ways that we can blunt the effect of stress on our lives. So in this case, the blood pressure in this particular patient, the blood pressure is a very visible and easily measurable marker of response to acute stress. But you may have other markers that are more subtle, but nonetheless, stress may be affecting you in a very negative way. So my encouragement is learn multiple stress reduction activities, do them on a daily and weekly basis, and you will be healthier, happier, and feel a lot less stressed in the long run. So I wish you well. God bless, and have a great day.